Welcome, and thank you for inquiring about our office. If you're suffering from chronic neck or low back pain, maybe pain running down your legs or numbness in your hands or your feet, you've come to the right place. My name is Dr. Thomas Ferrigno. I'm the owner of Bay Area Disc Centers, both here in Campbell and in San Mateo. I specialize in chronic disc-related conditions, disc herniation, degenerative disc disease, sciatica, and spinal stenosis. And these conditions can be debilitating for people. And they usually don't go away on their own. In fact, they actually get worse over the years. And that's why I have developed a program called Disc Restoration Therapy. And it's aimed at really targeting the underlying condition so we get longer term benefits. We want to be able to heal the disc, rehydrate that disc, reduce disc herniation size, thereby creating more room for those nerves that are exiting the spine. And if we do this, you are going to feel significantly better. Disc restoration therapy is a 5-step approach, and we call it our 5-step S.P.I.N.E, S.P.I.N.E approach, and each letter stands for a specific therapy in our office. So let's take a closer look at what spine's all about. First, spinal decompression. Non-surgical spinal decompression is actually invented by Dr. Aller and Dr. Norman Shealy, Harvard neurosurgeon. And what they wanted to do was find a way to treat severe disc injury, like disc herniation, spinal stenosis, degenerative disc disease, non-surgically, because surgery has not given the best results and it's risky. Not that we're against surgery, we just think it should be the last thing that you do. You should exhaust all non-surgical measures before doing surgery. So spinal decompression is a fantastic way to treat these conditions non-surgically. So what does it do and how does it work? Well, let's take a look. First, the goal of decompression is to be able to stretch one specific disc either in your neck or in your low back. And when we stretch that disc, we want to keep the muscles completely out of play. This way, we can actually get a negative pressure inside that disc to cause a vacuum effect, to suck in new fluid and nutrients to rehydrate the disc, and to suck in disc material to actually reduce the size of the disc herniation. And when we do these things, it's going to take pressure off those nerves that are causing you the pain and disability that you're dealing with. So decompression, it's safe, it's FDA cleared for safety. All our machines, we have nothing but the best equipment in this office. And I always tell people, it's so safe, I put my 91-year-old father on there and my 85-year-old mom on there. I wouldn't do that if I didn't think it was safe. And it's painless. Most people actually just fall asleep while they're on the table. My big joke is the two big side effects are snoring and drooling, right? That's how comfortable it is. And not just comfortable, it's effective. Now, that's spinal decompression. What else do we do? Physiotherapy. So we want to actually address some of the other symptoms that are going on. So after you get off the table, we're going to bring you in a different room. We're going to put you on electric muscle stimulation. This is going to help reduce pain, inflammation, reduce muscle spasm or tightness. And we'll usually put that on with an ice pack. You're on there for 15 minutes. When you get off that, now we're going to do something called laser therapy. We have both deep tissue or cold laser. Laser is really popular, especially popular in athletics. The key to laser is actually photons. It's the light therapy. You don't feel anything. The light therapy are photons. They go into the cell. They stimulate the mitochondria in the cell to produce more ATP or energy within the cell, making an unhealthy cell healthier. It takes away pain, it reduces inflammation, speeds up tissue healing. That's why athletes like it. Gets them back on the field or the court faster. I like it because our lasers can penetrate 5 inches into the spinal area to reduce inflammation in those deeper spinal regions. Next would be intersegmental mobilization. This is kind of like your chiropractic adjustment. Now, I treat a lot of elderly because spinal stenosis, disc degeneration comes with age sometimes. So no, we're not manually manipulating these people. We use specific tools to put motion into those segments. And it's painless and it's safe. But the key is to get those vertebral segments moving and functioning normally. Because if they move and function better, you're going to move and function better. And that is the key. Also, if you have motion in the segment, the disc moves better. And that's really how a disc naturally stays healthy. It's a movement-driven pumping mechanism. So as we move, the disc pumps new fluid in, waste products out. And that's really the key to keeping the disc healthy. Next would be N, nutritional support. Of course, we want to do everything we can to keep that disc healthy and support it. So we do several things. Maybe we teach you a little bit about a non-inflammatory diet, and taking away the sugars and the white floury products that cause inflammation, or certain supplementation that helps with supporting the health of the disc and the spinal joints. This is all important. Last but not least is exercise rehabilitation. And exercise is really important, but sometimes it's done at the wrong time with people with these conditions, or it's just going to irritate the condition. Our goal is to heal the disc first, and then we'll start adding exercises to strengthen up that core musculature to support that disc area. So that is what disc restoration therapy is in our 5-step spine approach. Now, who do you go to? Why Bay Area disc centers? Or maybe you don't live in this area. What questions should I be looking for to go to the right doctor to treat a more severe disc injury? Well, first, experience, right? And not just experience in how long someone's been in practice. I've been in practice 34 years, but how long have you been treating severe disc injury? I've been treating nothing but disc-related conditions for 20 years. In fact, there's really only 5 diagnoses that we treat in this office. We treat disc herniation, degenerative disc disease, sciatica, spinal stenosis, and facet arthrosis. That's 95% of our practice. We are truly specialized treating these types of conditions. 2, is the doctor certified in decompression? I'm not only certified, I'm actually the first doctor in the state of California nationally certified in spinal decompression, but not just me. All the doctors in our office are certified, and so is my staff, and that is important because they are doing a lot of the treatment, right? Third, I'm on the international advisory boards. Just only a few doctors in the country, maybe 10 medical, 10 chiropractic, who help teach other doctors how to do this procedure. And I've actually presented at the National Certification Program. So these are some of the things that I think are important when you're looking at a doctor. Is he educated? Does he have the experience? But the last thing, and I think the most important thing, does he have the passion? I am passionate about treating disc-related conditions because I have them myself. I suffered real early in age with a severe disc herniation, and now I have disc degeneration and spinal stenosis. So I know what my patients are going through, and it's horrible. And not until I started doing spinal decompression as a patient did it change really the course of my life and the course of my practice. I used to own sports injury centers, but it had such an impact on how I felt and my ability to continue doing sports and being active that I sold my sports injury centers and I opened up disc centers, and now that's all I do. So yes, I know what you're feeling like when you come in my office, and I'm sympathetic to it. I know what it's like to take 15 minutes to get off the couch and get to the bathroom because I've been there. And you know what? I'm better at 60 than I was in my 30s and 40s since spinal decompression, and I think we could probably help you. And no, we do not help everyone who walks in this office. So yeah, there are people out there who've done decompression and it may have not worked for them. But out of 10 people who walk in this office, we do real well with 8. And if you look at the research, and you could go on our website, bayareabackpain.com, under the research tab, I got research from Mayo Clinic, Johns Hopkins, Stanford, and all the research shows anywhere from 75 to 92% efficacy rates. So there's a good chance that you could do really well. And you know what? It's a better step to start non-surgically than to go diving into a surgery that then once you do it, it's permanent. And lastly, if maybe you're not in this area, how do I look for a doctor? My recommendation would be to go look for Disc Centers of America. We are a group of about 200 doctors with extensive training on disc-related conditions and how to treat and manage them. And these doctors are the best. And I've been part of Disc Centers of America for 10, 12 years now. And this is a group of the top of the line doctors. So if you're not in my area, you're looking for a friend, I'd be looking at Disc Centers of America. Otherwise, I have a great way for you to start in this office. We want to make it easy, and maybe the first goal is just to meet each other, see if there's a good fit. So for $49, we have you come in, we will do a full consultation, an examination. I will review any previously MRIs or x-rays that you have. If you don't have them, then we have to order new ones. And then once we have them, I will take the time and I will show you what's going on with your MRI, what's going on in your body. And if you're a good candidate for care, then I will give you my treatment recommendations. I'll tell you how long it's going to take, what it's going to entail, how much it's going to cost, if you have insurance, what they cover, what they don't. At that point, it's up to you on how you want to move forward. There's never pressure from us. But we'd love to help you. We'd love to have you in here and hope to see you soon.